Then there is a neuroleptic malignant syndrome. So in this, like, it is a rare but serious complication. So it is characterized by like muscle rigidity. There is a muscle rigidity, hyperpyrexia, mental confusion, and a coma. Some patients suffer from the coma, and it's treated if it is treated with like IV dentrolin. The dentrolin drug is given if their case is the neuroleptic malignant syndrome. When we are using the antipsychotic drug, and there is like there is like neuroleptic malignant syndrome, so we can treat to the patient like dentrolin if there is this type of sign and symptoms like muscle rigidity, hyperexia, and mental confusion and coma. Moving on the like tardive dyskinesia. Tardive means like late occurring, and it is characterized by like involuntary movement of the like mouth, tongue, and upper limbs. So it develops in like almost 20% of the patient after the month of or year of antipsychotic treatment. Like usually treatment is usually unsuccessful. And there is another like muscarinic there is another side effect like muscarinic alpha adrenergic receptor is blocked. So there is or and as one receptor is blocked, this other side effects are seen. And there is like weight gain is common with the clozapine and the olazapine. And when we look at the endocrine side effects, there is a endocrine side effect to increase prolactin, and this lead to the amenorrhea, eclectorrhea, and infertility in the female, gynecomastia in the male. And there is a hyperglycemia precipitation of the diabetic can occur with the chlorpro chlorpromazine. And there is a hypersensitivity reaction occurring that's like skin rashes, itching, dermatitis, leukopenia, and also rarely obstructive jaundice occurs. So this type of granulocytis, is a serious adverse effect of the clozapine. So this granulocytosis is a serious adverse effect of the clozapine. Now we are moving on the like halogens. Haloperidol. This is a group of like butyrophene group of the drugs. And regarding this, this is like a widely used antipsychotic drug, and pharmacological action is just similar to the chlorpromazine, and like it causes like severe EPS, extrapyramidal syndromes, and like has like less user potential but does not cause the weight gain and does not cause the hyperglycemia and the dyslipidemia, and it rarely causes the jaundice. So it is preferred agent acute schizophrenia, acute mania, and like senile psychosis and Huntington's disease also is preferred drugs. This is haloperidol. So there is like other antipsychotic drugs like atypical. So moving on the atypical drugs, we have discussed atypical drugs. So now moving on the atypical drugs. Like there is a this drug are exerting antipsychotic effect mainly in the like mainly acting on the like serotonin blockage. And when the serotonin is blocked, and they have the like weak action on the like D2 receptor, dopamine receptor. So there is a low risk of the like extrapyramidal syndromes. So now moving on the like the drugs, like there is like antipsychotic drugs, like there is chlorpromazine. So we are going to summarize into this table. Chlorpromazine, like it's potent to the D2 blocker, and when D2 is blocked, or muscarinic and H1 alpha 1 blockage, and there is action like seen. So there is a low potency, significant sedation, hypotension. It's like significant, and other action we have already discussed. Now moving on the like haloperidol or flufenazine. So it is like potent due to dopamine blockade, and also block the M1 muscarinic and the H1 alpha blockade. So it is like potent antipsychotic, and like less sedative and less hypotension drugs, and like weak anticholinergic action seen, and like it marked like there is a less there is like extrapyramidal symptoms, and like hyperprolactemia occur, and jaundice are rare. So now moving on the clozapine. Clozapine like potent in a certain blocker, and it's like act on the like D2 receptor weakly, but also blocks like muscarinic H1 and the alpha blocker. Uh, alpha blockade. So this drug lead to the like sedation and hypotension mainly, and there's less extrapyramidal action scenes, and like anticholinergic action are also seen. There minimal effect of the on the prolactin, so there is no prolactin, no gynecomastia, no galactoria. So it shows the granulocytosis. We need to learn this term, clozapine. There is granulocytosis. So this like it's like precipitate seizure and weight gain, also hypersalivation seen in this case due to and hypersalivation, and the reserved drug for the resistance cases. It is a reserved drug for the resistance. In the resistance cases we can given the clozapine. Now moving on the olanzapine. In olanzapine, it is like potent of the potent serotonin blocker, and also weak action on the D2 receptor, and like also it block the H1 histaminic receptor, also H1 histaminic muscarinic, and the alpha blockade. So it's so action like sedation, hypertension more, and less extrapyramidal syndromes, and like minimal effect on the prolactin, and also potent anticholinergic. It is a potent anticholinergic, and like it's precipitate seizure and weight gain, also hyperglycemia seen in this drug, in the case of this drug. Now moving on the risperidone. So risperidone is also a serotonin blocker, and when it blocks serotonin, also it blocks the dopamine, muscarinic, and histaminic, and alpha 1 blocks. So when we look at sedation, and it shows like action of sedation, hypertension more, and like low dose, like it is given especially less than 6 mg per deciliter. So less there is a less extrapyramidal syndrome, but increases prolactin level also. It increases the prolactin and less likely to cause a seizure. It helps with the prevention of seizure. So gipradison. Now moving on the gipradison. Gipradison is like serotonin and D2 dopamine blocker, and it's like less in this case there is a less extrapyramidal symptoms. Now moving on the aripiprazole. This aripiprazole is also like the other partial agonist of the D2, but the blockage of the serotonin. So its cause, but its action so like a minimal effect on the prolactin, and also less weight gain and less hyperglycemia. Moving on the like quetiapina is a drug like serotonin. It's act on the serotonin 1A receptor, and serotonin T2 receptor, serotonin, and also like it's also block D2 receptor. So there is sedation, QT prolongation seen, and due to the there is a amisuloprid is a D2 blocker, and it has to like less its action is a less extrapyramidal, like it's a topical antipsychotic, and there is no sedation, there is also QT prolongation seen. So these are the some drug, and there are the actions, and there are where each acts. Now moving on the like clozapine and the olazapine. So regarding this drug, this is a typical antipsychotic drug, and this clozapine and the olazapine, like it's a typical antipsychotic drug, like minimally block the 5 serotonin receptor, and have the D2 have action, like have weak blockage of the like D2 receptor, dopamine receptor 2 type 2, and that is also act on the alpha receptor, alpha 1 receptor as well, and muscarinic receptor. So it causes sedation and hypertension, and rarely cause the extrapyramidal symptoms. Like when we look at the adverse events, clozapine are the sedation, salivation, seizure, and weight gain. Hypotension. A dangerous side effects are the granulocytosis. Granulocytosis is a one you need to learn and remember, and here. Hence, the regular monitoring and blood count is required for during the clozapine therapy. So the side effect of the side of the olazapine is rarely it is like olazapine cause the dry mouth, constipation, weight gain, and rarely extrapyramidal symptoms. So it does not cause cause granulocytosis. Now moving on usage of the clonazepam. Clozapine. Clozapine is a reserved drug for the treatment of the schizophrenia because of the risk of granulocytosis, and olanzapine is used for treatment of the schizophrenia with the mania and associated with the bipolar disorder. If associated with the bipolar disorder, and they suppress both positive symptoms through thought disorder, hallucination, and delusion. Also, negative symptoms like social withdrawal, lack of the motivation, and the also flattening of emotion of the schizophrenia. It's helpful in this data in these cases, like thought processes and also like motivational processes. So moving on, the like another drug is like risperidone, risperidone, risperidone. Risperidone is like a typical antipsychotic drug, and it blocks the D2 serotonin and the alpha adrenergic and histamine receptor also. And when it in this case there is a like extrapyramidal syndrome are the rare and the low doses. So there is a, like a treatment. It is used for treatment schizophrenia, long and short-term treatment of the mania, and associated with the bipolar disorder. So other typical antipsychotic are the aripiprazole and ziprasidone, and this is a quetiapine, quetiapine, and amisulpride. These are drug like use of the therapeutic like schizophrenia, mania, and antiemetic. Also in intractable hiccup. hiccup. So when we look at the like in the schizophrenia, like the neuroleptic are the only efficacious drug available of the treatment of the schizophrenia for the effective schizophrenia, and the atypical antipsychotic commonly prescribed owing on the lower risk of the extrapyramidal risperidone, olanzapine, and aripiprazole. There is ziprasidone, and these drugs are frequently used. And clonazepam is resolved resistance cases of the schizophrenia of the older agent like haloperidol and the flufenazide are commonly used. So in the regarding mania, like acute mania, we can treat with the neuroleptic like chlorpromazine and or the haloperidol, and the lithium is used to the maintain the maintenance therapy, and a typical antipsychotic like the olanzapine, risperidone, quetiapine, and aripiprazole are the commonly used in the acute mania. So if the parenterally therapy is required, so older agent like chlorpromazine or the haloperidol are used. And in the case of antiemetics, like there is a phenothiazide and haloperidol, it produce the antiemetic effect of T2 receptor in the citizen area. Now it's however they are not routinely used in the antiemetics because of their side effect like phenothiazine, such as the prochlorperazine is useful for prevention of treatment of the nausea and vomiting associated with the migraine or the emesis due to the anti-cancer drugs. And now regarding this intractable hiccup has like treated with the chlorpromazine as adjuvant with the selective serotonin reuptake inhibitor in the anxiety. This is the regarding the drugs of the antipsychotic drugs. We have already discussed all of the things what is given in this book. So